Hi, I am Dr. Prashant Patil, Senior Pediatric Cardiologist from Care Children Heart Institute. Congenital heart defect is the most common birth defect. They are defect in the heart which affects the structure and function of the heart. Range from a small hole inside the heart to the complex lesion where one of the ventricles or one of the arteries are not formed. The incidence of the congenital heart disease in the world is 1 out of 100 babies. That means out of 100 live born babies, one baby can have a heart disease. If you consider India, every 3 minutes one baby is born with a heart disease, out of which 20% patients require a surgery in first 1 year of life. So in India, almost the incidence is 20 to 25,000 surgeries are required in India per year. The congenital heart diseases can be divided into two types. One is a cyanotic heart disease where the baby is pink, and cyanotic heart disease where the baby is blue. Most of the blue babies will need a surgery or an intervention early in the life, while as acyanotic, that means pink babies, may require interventions, or sometimes they just need a medicine or they can be on regular follow-up. The symptoms of the heart diseases can be rapid breathing, that is fast, if your baby is breathing fast, or if baby has a rapid heart rate. Sometimes baby can become blue. Many times baby will not gain weight, or they will have recurrent infections which require hospitalization. If it is a terminal disease, the baby can have a swelling over the limbs and the face. Sometimes they present with a sudden death. Once the child is found to have symptom, your pediatrician may refer you to the pediatric cardiologist, who is the specialist in child heart defect. Once the patient is evaluated by the pediatric cardiologist, they will advise certain test of investigations to you. That includes electrocardiogram, X-ray chest, and echo. Echocardiography is ultrasound of the chest, which will detect the structural and functional problems of the heart. Once the defect is diagnosed, the pediatric cardiologist will decide the kind of treatment or kind of additional investigations he will require. That may include the CT scan or MRI, or sometimes the catheterization. Once the type of defect and the severity is assessed by the pediatric cardiologist, the patient will be referred for the surgical correction or the interventions. If your child has a hole in the heart, or if he has a wall problems, he may require angiographic intervention such as device closures or balloon valvoplasties, or sometimes the stenting of the vessel or a wall. If it is a complex heart problem, usually he will need a surgery. Ventricular septal defect is a defect in the lower part of the heart between the left and right ventricle. It is the most common congenital heart defect found across the population, and it is more common in females. There are different kinds of VSDs. They are divided into the inlet VSDs, muscular VSDs, subpulmonic VSDs, and subaortic VSDs. Depending upon the size of the VSDs, patients can have symptoms. If the hole is very small, patient may not have any symptoms and patient may not need any treatment. If the hole is medium sized, your child may present with low weight gain or recurrent infections. And this kind of a VSD can be closed either surgically or by the interventions with a device. If the hole is large, your child may require a surgical correction. Thank you.